are an interdisciplinary team of many medical students, nursing students, physical therapy students, and we get to work with a lot of different healthcare providers here who are really coming together in order to give a bunch of patients in Brooklyn who are uninsured and underserved high quality care. We are open from 5 to about 10 p.m. every Wednesday night. We're always precepted by an attending physician here, usually affiliated with Downstate, residents who are here almost every week to see some patients with who have those needs.
Well, the BFC is an incredibly unique aspect of not just the medical school, but the nursing school and the public health school. It really helps us as students learn what it means to be involved in an interdisciplinary team before we're even in the professional world.
Well, I found out about the Brooklyn Free Clinic through Google. I was looking for a way that I can be examined for free in Brooklyn, and the first thing that popped up was the Brooklyn Free Clinic, so I jumped at the opportunity. Well, the staff are very, very thorough, very well trained. You can see that they know what they're doing.
I'm one of the chief nursing officers here, and I started the nursing program here in May 2019. Even before I came to school here, I knew this was something that I wanted to be involved in because I have a background and passion for community work. So I really love the service that we do for the community here. You know, we connect so many Brooklyn residents to care that they might not be able to get without our clinic, since we see patients who are only uninsured. So whenever we have patients come in here, we get a lot of compliments for the service that we do. Everything that happens at the clinic is free of charge for the patient. And then there's also a lot of enthusiasm from the students working here to provide very good care for them. So I think that the patients feel very supported here.
When I actually needed to get some blood work done, I came like maybe last year, the very first time, like 2019. I really appreciate like the work that everybody does, it's really helpful when people actually like need, like people who like are in need of like healthcare. It's very difficult to get that in like out in like normal clinics because due to like costs and everything.
Patients are extremely grateful. They know that they're receiving free healthcare here, and they're very patient with the student volunteers here who are offering that kind of care. And so it only makes me want to do better as a student to provide the best quality of care I can. We saw 513 patients from August 2018 to August 2019, and these are patients who are there when they're most vulnerable and there when they need us the most.
The students are really here for the patients. They have committed themselves to the educational system. So I'm here to show students how to provide cost-conscious care in a low-resource community that reaches the same levels of quality that we provide to patients who are insured.
One patient that I worked with at the beginning of my tenure as CMO was an immigrant who had never gotten a pap smear before. And she was young, but almost my age, and when I did her pap smear, I immediately noticed that something didn't look right. And so when the pap smear came back as high risk, I had to be the one to fully take on their care. So I went to an OBGYN here at Downstate who I worked with on one of my clerkship rotations. And she offered to do the colposcopy for free for the patient. And we worked it out so the patient could come in, get her colposcopy done to see what stage she was in. So it was really satisfying just to see that a patient had an issue, come up with multiple solutions, talk to multiple people throughout Downstate, Kings County, and then even within the Brooklyn area to get this patient the care that she needed.
I heard that Downstate was one of the schools that when you graduate, the students leave with so much more clinical experience because they give you early clinical exposure. So that's definitely one of the top reasons why. Like I said, I want to be as clinical as possible. I'm not like a lab person. I want to see patients. I want to be hands-on. That's like what I'm into. So Downstate had opportunities to do that.
I think what's really remarkable is that we have a lot of patients who've been coming here for years. When you hear about a free clinic, I always thought it was something that somebody would come kind of as a drop-in if they had nowhere else to go. But the care that the patients receive here keeps them coming back as their regular provider. So that's something that's been very inspiring to me.
So it is crucial, I think, for us to maintain that mantra to do no harm and to not exploit these patients. Because for many of them, we're one of their only avenues of obtaining health care. And so it's a real privilege to be able to serve them.